Hi everyone, today marks 16 months for me on my R3tA clinical trial, so I thought today I would answer another commonly asked question of me, which is what have the side effects been like on R3tA? If you don't know me, my social media handle is Mimi in Australia, and I've been on a R3tA clinical trial for the last 16 months. I've lost over 36% of my body weight. My starting BMI was 36.2 and I'm now down to 23.0. So the side effects are, first of all, are nothing that hasn't already previously been seen with other GLPs. There's nothing new, I don't think, with retatrutide. So I'll broadly divide them into gastrointestinal, skin, and then cardiac. So in terms of gastrointestinal, vomiting, I haven't had any. Nausea, I had to take an anti-nausea medication once. Constipation I had in the first month. I think that was because of my extremely reduced food intake though. And diarrhea I did periodically have during the grading up phase in the first 5 months. And that's not very nice, but it's never very nice regardless of the cause. In terms of skin, I will preface this with saying I do have quite sensitive skin anyway. For example, if I go to the physio and I want to use any strapping tape, that will usually make me come out in welts. So I did also get some rather large injection site reactions. They were red and itchy and did look a bit like welts or hives. That was mainly during the initial 5 months dosing up schedule. And then by the 6-month mark, everything kind of settled, and I rarely now get maybe a little bit of redness at the injection site. The other thing that I also got was allodynia, or the skin sensitivity. The best way I could describe that, it feels like being sunburnt. That was quite unpleasant to deal with. I did get some relief from simple painkillers and over-the-counter non-sedating antihistamines, but again, it all settled down by the 6-month mark once I had stopped grading up on the drug. So for retatrutide, the big one that everybody's really interested in is cardiac side effects. So there's a number of different retatrutide trials going on, all looking at different things: diabetes and osteoarthritis, kidney disease. I'm in the trial that is specifically looking at cardiovascular disease. In order to qualify for my trial, you had to have a previous history of a heart attack or stroke. So everybody in my trial group has already got a cardiac history. So I would say that if any group was going to have cardiac issues, it would be the group that I'm in. So what have I noticed? My heart rate is definitely higher. It's about 10 beats per minute higher than it was previously. But I don't feel it. I don't notice it. I'm not dizzy. I'm not short of breath. The only reason that I know that it's higher is when, for instance, I get on the treadmill and I'm using the little grips that tell you what your heart rate is, or if I'm measuring my blood pressure with an electronic blood pressure cuff, that will also give me a heart rate as well. I don't wear an Apple Watch, so I don't know what it is. And that's really the only way that I knew at all that my heart rate had gone up. They do follow us cardiac-wise very closely in the trial. So every couple of months, I'll have to go in and I'll have to have a set of 3 ECGs or EKGs done. So they'll do 3 in a row just to make sure that they're getting a really good read. And I've never ever had any issues with any of my ECGs. So essentially that's the side effect profile for me on retatrutide. Once I had finished grading up, everything settled down totally at the 6-month mark, and I really don't have any side effects at all these days. Thanks for listening. I would really love it if you could give me a like or a follow. I would love to get to 1,000 followers so I could go live. If you have any questions, please feel free to pop them in the chat. Otherwise, I wish you a great day. Thanks. Bye.